Hello, I am Dawn Bleckman, and I want to share an important message regarding strep throat. Every year in every school across the country, it is almost a guarantee that a child will be diagnosed with strep throat. Each year, there are approximately 600 million cases according to Infection Control Today. Strep throat is a common childhood illness that is highly infectious and can easily spread through a school setting or early childhood program. Strep throat is a bacterial infection that can cause inflammation and pain in the throat and tonsils. According to the Health, Safety, and Nutrition for the Young Child 10th edition 2020 by Lynn R. Moratz, the strep bacteria called Streptococcus causes almost 1/3 of sore throats. Strep throat can manifest as not only a severely sore throat, but stomach pain, fever, and swollen tonsils. Families must remember that if they see symptoms, even symptoms that come on suddenly, such as white spots or patches on the back of the throat or tonsils, red throat rash, their child experiencing pain when swallowing, the child has a fever of 101 degrees or higher, or the experience of appetite loss, stomach ache, nausea, vomiting, or headache, strep throat usually requires a trip to the doctor for a throat culture. Antibiotics may be prescribed because left untreated, strep throat can lead to rheumatic fever and other serious complications. It can even spread to other organs. Most children can safely return to school after being on the prescribed antibiotics for 24 hours. Strep throat can be prevented if we wash our hands often so that we don't spread germs. Sneezing and coughing into our elbows or into a tissue, and by avoiding touching our faces with dirty hands. Families and schools should encourage children to wash their hands before and after eating, after using the bathroom, and after playing outside or returning home. Parents should encourage children to wash for the appropriate amount of time and following the recommended steps. These are wet, lather, scrub, and dry. Families should remain on the same page as their schools, encouraging their children to cough and sneeze in their elbows or into a tissue and not directly on their hands, which will then be spread to commonly shared items. Families should keep sick children home until symptoms have abated or a doctor has stated they can safely return to the classroom, which again will usually be 24 hours after beginning antibiotics. Families should inform the school of a strep throat diagnosis so that schools can send a notice to all students and families who may have been exposed about the outbreak, common signs and symptoms, and the incubation period. Schools must not allow children to return to school while they are still contagious. Families must clean items at home that siblings might share and check siblings for signs of strep and see that the correct medicine is given. Following these strategies will promote the health and safety of your children and family as well as the other children and families in the school. Schools and teachers must also promote the health and safety of their students and fellow employees by actively disinfecting their classrooms regularly. Especially common areas that have high traffic should be cleaned daily. Tables and toys that are routinely used need to be disinfected. Toys must also be disinfected before sharing with another child. Personal items should not be shared. Staff members should wash hands and use gloves before handling food. Teachers should encourage children to wash their hands often, including when they first arrive to school, to help stop the spread of germs. Children with certain symptoms should be sent home, enforcing established classroom policies.